and goodness have appointed the offices of leaders and legislative assemblies for the welfare of society and the just government of the people, we beseech you to be awed with your abundant favor as your servants whom you have been pleased to call to the performance of important trust in this republic. Let your blessing descend upon us here assembled, and grant we treat and consider all matters that shall come under our deliberation in so just and faithful a manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our country and those whose interest you have committed to our charge. Amen. Honorable members, I welcome you to the afternoon session. Honorable members, I welcome you to the afternoon session. Clerk, proceed.
Order number 1, administration of oath.
Proceed.
Order number 2, communication from the chair.
Clerk, proceed.
Order number 3, messages.
Proceed.
Order number 4, petitions.
Proceed.
Order number 5, papers.
Under this order, we have one order by Honorable Dominic Dambuki. Notice of motion. Okay, sorry. Clerk, proceed.
Order number 6, notices of motion.
Under this order, we have one motion by Honorable Dambuki.
Thank you, Honorable Speaker. My name is Honorable Dominic Ndambuki, MCA Kathiani Central Ward. Honorable Speaker, that aware that the Constitution of Kenya 2010 and Vision 2030 have spelled out the right of the attainment of the highest standard of health to the citizens, which calls for comprehensive, effective, and efficient infrastructural development. Further, aware that good health infrastructure links people to health facilities and access to quality healthcare services. Informed that performance of ambulance services are measured using indicators such as technical efficiency, response time, on-scene time, and client satisfaction. Cognizant that inadequate ambulances have been a challenge in the county since a single ambulance is scheduled to cover a large geographical area, or the ambulance either has no required standard equipment or the equipment are not properly functioning. Considering that the county government of Machakos since devolution has made a great milestone in purchasing ambulances to address health emergency services, noting that currently most of these ambulances lack requisite equipment such as portable oxygen apparatus, portable and fixed suction apparatus, portable and fixed oxygen supply equipment, and oxygen administration equipment, among others. Aware that this state of affairs risks losing lives that would otherwise have been saved if the ambulance facility is well equipped with the said equipment. Honorable Speaker, pursuant to Standing Order number 44, I wish to give a notice of motion that the Department of Health and Emergency Services in Machakos County equips the existing ambulances with all the requisite safety equipment and assigns a modern ambulance to Kathiani Level 4 Hospital. Thank you, Honorable Speaker.
Thank you, Honorable Ndambuki. Clerk, proceed.
Order number 7, statements.
Proceed, clerk.
Order number 8, motion, approval of report of Health and Emergency Services Committee on budget implementation of the Department of Health and Emergency Services for the financial year 2019-2020.
Under this order, we have one motion by Honorable Jacinta, approval of report Health and Emergency Services Committee on budget implementation of the Department of Health and Emergency Services for financial year 2019-2020. Honorable Jacinta.
Thank you, Madam Speaker. My name is Honorable Jacinta Ndambiluka, nominated by Wiper Party. Honorable Speaker, that aware that the 4th schedule of the Constitution of Kenya 2010 mandates government to deal with all matters related to county health services and including in particular county health facilities and pharmacies, ambulance services, promotion of primary health care, licensing and control of undertakings that sell food to the public, cemeteries, funerals, parlors, and crematoria, and refuse removal, refuse dumps and solid waste disposal, fighting services, and disaster management. Aware that Article 183.3 of the Constitution of Kenya 2010 provides that the County Executive Committee shall provide the County Assembly with full and legible reports on matters relating to the county, informed that in exercise of the function vested on County Assembly in Article 185.3 of the same Constitution, the County Assembly, through the Committee of Health and Emergency Services, requested for the Departmental Performance Report for the Department of Health and Emergency Services for the financial year 2019-2020. Constant that pursuant to Standing Order 190, Part 5, the committee analyzed the report, conducted site visits, and consequently compiled a report. Honorable Speaker, I wish to move the motion that this Honorable House discusses and approves the report of the Committee on Health and Emergency Services on the budget implementation for the Department of Health and Emergency Services for financial year 2019-2020. Thank you.
Honorable Jacinta, you may call a seconder.
And I call Honorable Angela Munyasia to second the motion.
Thank you, Honorable Speaker. My name is Angela Munyasia, nominated by Wiper Democratic Movement. I stand to second the motion.
Thank you, Honorable Jacinta. You may continue.
Thank you, Honorable Speaker. In the report, we have the introduction, 1.0. Then we have 1.1, preface. And 1.2, we have the mandate of the committee. In 1.3, we have the committee composition, where we have the committee composition of the time this report was compiled members was as follows. We had Honorable Cosmas Masesi, Chairperson, Honorable Pauline Munguti, Vice Chairperson. The following members: Honorable Paul Museko, Honorable Tariq Mulatia, Honorable Peter Mutiso, Honorable Johanna Munya, Honorable Jacinta Luka, Honorable Patrick Kituku, Honorable Anastasia Mutuko, Honorable Daniel Mbevi, Honorable Kaloki Kusia, Honorable Anton Mulu, Honorable Winfred Mutua. 2.0, legal framework provided for in page 4. 3.0, matter under consideration. The committee considered the following documents. A, overall budget for financial year 2019-2020, page 5 and 6. B, departmental report for the financial year 2019-2020, pages 6, 7, and 8. C, report on control of budget, pages 8 and 9. 3.4, committee site visits. Honorable Speaker, further, the committee conducted site visits to sample project done in level 5 and 4 hospitals, dispensaries, community hospitals, and health centers. The site visits were done between 26th and 30th October 2020. 3.5, discussion with chief officers. Honorable Speaker, Article 195(1) of the Constitution of Kenya 2010 stipulates that a county assembly or any of its committee has power to summon any person to appear before it for the purpose of giving evidence or providing information. Section 39(2) of the County Government Act 2012 states that a committee of the County Assembly may require a member of the Executive Committee to A, attend or appear before the committee, and B, answer any question relating to the member's responsibilities. Further, Section 18(1) of the County Assembly's Powers and Privileges Act 2017 states that a county assembly or its committees may invite or summon any person to appear before it for the purpose of giving evidence or providing any information, paper, book, record, or document in the possession or under the control of that person, and in this respect, a county assembly and its committees shall have the same powers as the High Court as specified under Article 195 of the Constitution. This committee invited the Chief Officer, Department of Emergency Services, for a meeting on 9th November 2020. The invitation was through a letter reference number MKSCA/PCS/CMM/HES/Volume 3/61, dated 19th October 2020. 4.0, Committee Observations. 4.1, Observation from the Departmental Report, COB Report and Departmental Budget for the financial year 2019-2020. Honorable Speaker, the committee interrogated the above reports and observed the following. 1, the county health facilities were allocated budgets based on the data of patients they attend to in a given period. 2, the budget allocated under public health and community outreach program is meant for level 3 and level 4 and level 2 hospitals. 3, the department's absorption rate of the financial year 2019-2020 budget was very low, with the recurrent and in development being 46.7% and 17.1% respectively. Further, the sub-program on emergency services had 0 receipts despite having an approved budget of Kenya shillings 21,095,884. This is according to the report of the Controller of Budget. 4.2, Observation from site visits. Honorable Speaker, from the site visits conducted, the following were the observation. 1. That as the date of the site visit, 26th October 2020, the health facility at Mlolongo Community Hospital was initiated in 2015 and expected to be completed by 2019, but the phase of the works was very low. The project was 98% complete, Kenya shillings 10,034,368, and being paid out of the contract sum of Kenya shillings 13,067,695. 2. According to the report from the department, Divine Community Hospital was indicated to be at 40% completion. This contradicts the actual status of the project as it was as lento stage. The committee disputed the status of the project as indicated in the report and rated it at 15%. 3. Mukunike Community Hospital in Kangundo West ward was 100% complete according to the initial bill of quantities. However, works were ongoing to include a placenta pit and toilets occasioned by a varied bill of quantities. 4. Kusiomwamo Community Hospital in Machakos Central Ward was initiated in 2014 and expected to be completed by June 2015. As at the time of visit, the project had stalled at rental stage. The project had been neglected and the stalled building risked falling down. 5. The renovations works done in Mwala Level 4 Hospital on the laundry and kitchen facilities had not been completed. The building had no doors and windows, but roofing had been done. The contractor was not on site. The toilets in hospital had been constructed to completion, but they were not being used. 5.0 Committee findings. Honorable Speaker, based on the above observation, the committee made the following findings. 1. None of the community health facilities collects fees and charges from patients because of the Universal Health Coverage Program, which was launched by His Excellency the President of the Republic of Kenya on 18th December 2018, with Machakos being one of the pilot counties. According to the Chief Officer, the last disbursement from the national government towards UHC was last received in April 2020. Additionally, the Chief Officer highlighted that disbursement of funds to health facilities from the county treasury was not consistent, hence the public outcry on shortage of pharmaceutical and non-pharmaceutical supplies. 2. That apart from the conditional grants from DANIDA, which was transferred to level 2 and 3 health facilities, the Department of Public Health and Community Outreach had Kenya shillings 62,300,168 for development in the same facilities. 3. Community hospitals were projects initiated in the financial year 2014-2015 and were to be constructed in all the 40 wards. 19 community hospitals were ongoing while 9 are stalled. Construction works in the ongoing project was being done at our office. The committee engaged contractors in areas where construction was ongoing and the slow pace was blamed on payments of certificates. The chief officers on the other side blamed the delay on payments of certificates to the Department of Finance where the actual payments are done. 4. On low absorption rate of the budget, the chief officer informed the committee that they didn't have end-to-end access to the payment procedure and only processed payments up to the internet banking, but the Department of Finance decides on what to be paid. Further, there was no proper communication between the two departments. The Department of Health gets to know what payments were made in at the end of the financial year. 5. On actual receipts of funds in the emergency sub-program, the Chief Officer, Public Health and Community Outreach clarified that the funds were released at the end of the financial year and appropriated through the first supplementary budget of the financial year 2020-2021. 6. That is status of most projects listed by the department contradicted the actual states. This was after the committee conducted site visits in sampled projects. A good example is the status of the laundry and kitchen facility in Mwala Level 4, which was indicated to be complete. During the site visit, the committee observed that doors and windows were yet to be fixed. 7. The toilet at Mwala Level 4 Hospital was completed in the financial year under constellation, but since the contractor had not been paid, handing over had not been done. The hospital staff and patients were using toilets which were in bad state. 6.0 Committee's recommendations. Honorable Speaker, this committee hereby makes the following recommendations. 1. Universal health coverage funds from the national government are not forthcoming since April 2020. Article 185(1) of the Constitution of Kenya 2010 states that the legislative authority of the county is vested in and exercised by its county assembly. This bestows the county assembly with the mandate to approve county budgets. Honorable Speaker, the county assembly has been approving sufficient budgets to fund all programs in the Department of Health and Emergency Services. In this regard, this committee recommends that timely disbursement of funds to health facilities from the county treasury must be adhered to. 2. Section 45(4) of the County Government Act 2012 states that a county chief officer shall be authorized officer in respect of exercise of delegated power. The committee recommends that chief officers being granted end-to-end access to the payment process because they are the departmental accounting officers. This way, they will have full information on the budget implementation reports of their respective departments. Further, the chief officer will also ensure that certificates are paid on time and avoid inconveniencing the contractors. 3. The department should ensure that they give accurate information to the county assembly on actual status of the projects. 4. The department should ensure that before new projects are initiated, certificates of ongoing projects are paid and completed projects are fully paid and commissioned. 7.0 Conclusion and Acknowledgement. Honorable Speaker, allow me to acknowledge the Department of Health and Emergency Services for fulfilling their constitutional mandate by submitting the departmental performance report for the financial year 2019-2020 according to Article 183(3) of the Constitution of Kenya 2010. I wish to appreciate the Health and Emergency Services Committee members for their dedication during site visits, committee sittings, and compiling of this report. Honorable Speaker, the committee expresses gratitude to the Office of the Speaker and that of the Clerk to the County Assembly for the continuous and relentless support received as it discharged its oversight mandate. It is therefore my duty and on behalf of the Health and Emergency Services Committee to table this report and recommend it to this Honorable House for consideration and adoption. Thank you, Honorable Speaker.
Thank you, Honorable Jacinta, for that elaborate report. Honorable members, I now propose the question that this Honorable House discusses and approves the report of Committee on Health and Emergency Services on the budget implementation for the Department of Health and Emergency Services for financial year 2019-2020. Honorable members, the floor is now open for discussion. I welcome you all. Yes, Honorable Mita.
Thank you, Honorable Speaker, for the opportunity to make my contributions to this report. Honorable Speaker, I want to first applaud the committee for a well done job. The report is very elaborate, Honorable Speaker. It actually covers the whole county. So it highlights the challenges across our county in our hospitals at different levels, Honorable Speaker. Even though there is one uniformity on the issue of how the hospitals, the challenges with our hospitals, Madam Speaker. The major issue here is on finance. Our hospitals seems to be not operating properly due to lack of budgets, Honorable Speaker. It's unfortunate because, Honorable Speaker, we have been passing budgets in this House, and the Health Department has been carrying the lion's share on matters related to budgets. And I would have assumed those in charge of the department ought to have come up with a plan, Honorable Speaker, and project on how to spend the finances availed through the department at different stages of the financial year, Honorable Speaker. And my take is this would reduce the issues of hospitals running out of utilities, Honorable Speaker, like we have been experiencing and we are even currently experiencing. Also, Honorable Speaker, these issues of hospitals being constructed, contractors not being paid, Madam Speaker, I believe before they give out a contract, the first thing they do is setting out budget and allocating funds. So I would believe that after they have given out works to be done in different hospitals, they ought to have the money ready so that after completion of these facilities, the contractors are paid on time. Honorable Speaker, another thing which I should highlight is these issues of lack of medicine in our hospitals due to lack of payments. Honorable Speaker, it's not supposed to be coming out at this age. Madam Speaker, I believe we source medicine from different sources, and we have established a relationship with our suppliers, Madam Speaker, so that when we run short of funds, the source must always be there to cover the county through supply of medicine, and whenever the funds are available, the departments make payments upon what is due at that time. Honorable Speaker, again, we need also to take into consideration and prioritize projects under health department which have stalled, Madam Speaker. As I've always been talking about the mega clinics which were constructed in the year 2014, Honorable Speaker, and most of them have not been completed, they have stalled. And it's very important, Madam Speaker, especially now when the term of this government is coming to an end, they ensure that they don't leave white elephant projects behind, Honorable Speaker. So they can take that issue as a matter of urgency and ensure that the stalled projects are completed before the end of this fiscal year. So, Honorable Speaker, I want to thank the committee, the Health Committee, for the report, and I hope once we adopt the report, the executive will be able to implement on the issues which are being touched on. Thank you, Honorable Speaker.
Thank you, Honorable Mita. Honorable Mutinda.
Thank you, Madam Speaker. My name is Thomas Mutinda, representing Wamonyo Ward. Let me start by thanking the committee for the good job, Madam Speaker, and also thank you for the opportunity that you are heading this honorable house today. Madam Speaker, let me say that this report is good and timely, and Madam Speaker, I do wish that the House approves it, and that I think it's important that whatever is happening down there is given so that our health systems are working. Madam Speaker, I think it's the high time that this House monitors the usage of monies in the Department of Health, Madam Speaker, because that's where we give big budget from all the monies we have for the county. And the main reason is to have our people taken care of and have good health, because good health will give wealth, good wealth. So, Madam Speaker, I think it's important to note that those payments, those who have not been paid, it's important to have them paid. I think, Madam Speaker, when we are talking of accountability, is when we are able to say, this was the funds allocated for this department or for this purpose, and it has been used. Being used is not when we see, as I've heard that repairs were done somewhere, the things are being seen, but the payments have not been done. Because if funds have been allocated for a purpose, let the funds be used for that purpose, Madam Speaker. So I think it's important that we ensure, not even in the Department of Health, even other departments, on the level of accountability, we have to ensure that as we do accountability, payments have been done. I'm privileged to have served at a time when we used to use performance contracting. Unless you have proof of payment of what you say or you purport to have done, then there should be proof of payment so that accountability is taken into account. So, Madam Speaker, I support the report, and also say that it's important that we go the preventive way of treatment, so that we ensure that a lot of emphasis is on preventive health care. And on that, I do wish that the CHVs, the community health volunteers, are supported. It's important that the issue of CHVs is checked. I remember this House passed budget, a big budget to have them paid, and I think up to now they have not been fully paid for the months which had been worked. So it's important that those CHP group is paid so that they continue offering services. Actually, Madam Speaker, it's not a pay, it's just a stipend, something to keep them going, something to pay a motorcycle when they are moving within the area. So if we have to ensure that we have preventive health care working for us, then we have to have those group checked and supported. So with those few remarks, Madam Speaker, I support the report. Thank you.
Thank you, Honorable Mutinda. Yes, Honorable Rosina.
Thank you, Madam Speaker. And first, I applaud you for the seat you are sitting on this afternoon. I'm just concerned by one report where they said when they had a site visit, they found that a toilet had been completed and it was not being used. So I'm only advising that the contractor make use of the resources. When a facility is completed and it's not being used, that is total wastage of county resources. Thank you, Madam Speaker.
Honorable members, I now call the mover to reply.
Thank you, Madam Speaker. I think the report shows well how the money has been, how the hospitals have been funded, and you can see that during 30 years, there has been many hiccups because contractors had not been getting the money that as expected, and that delay makes the facilities to be commissioned late or never commissioned, and the patient suffer because the hospitals or constructions are not in use, and still you find that in hospitals medicines are not there because funds has not been, hospitals has not been funded. So I think much is needed in our hospitals so that there can be smooth running of the hospitals. Thank you, Honorable Speaker.
Thank you, Honorable Jacinta. Members, I now put the question that this Honorable House discusses and approves the report of Committee on Health and Emergency Services on the budget implementation for the Department of Health and Emergency Services for financial year 2019-2020. As many as are of the opinion say ayes.
Ayes.
As many are of the contrary opinion say nay. The ayes have it. Honorable members, as we know very well, in our Constitution, Chapter 43, every Kenyan has a right to health. It's my advice to the elected members, when we are giving projects financial year 21-22, please put some money in the stalled project, because when you start a project and you have another one which is not completed, then we are wasting resources. And I know if you put health into consideration, we will move ahead. It's my plea to the CEC, Health and Services Emergency, and the CEO to take up this mantle and make sure they work tirelessly, because they have been given the mandate because of the people. So members, thank you very much for today. And now the House stands adjourned till Tuesday. We will resume on Tuesday, 19th day of October, 2021 at 10 a.m. Thank you.